Thank you so much, Anne. Thank you for sharing your infectious passion with us and for getting us ready for today. I think it's been a great start so far. Before we get into the rest of our presentations, that video that's been dying to be seen, it is ready for you guys. So we'll go ahead and kick that off, and then we'll go into our presentations. The Surgeon General has just been dying to speak to everybody.
Hello, I'm U.S. Surgeon General Dr. Vivek Murthy. Today, for the first time in the history of our office, I am issuing a Surgeon General's advisory on firearm violence. It outlines the urgent threat firearm violence poses to the health and well-being of our country. As a doctor, I've seen the consequences of firearm violence up close in the lives of the patients I've cared for over the years. These are moms and dads, sons and daughters, all of whom were robbed of their physical and mental health by senseless acts of violence. Unfortunately, the problem has continued to grow. 54% of adults in America report that they or a family member have experienced a firearm-related incident, whether they've been personally threatened with or injured by a firearm, lost a family member, witnessed a shooting, or shot a firearm in self-defense. Many of these harms are disproportionately felt in our communities. Black individuals endure the highest rates of firearm homicides, while suicide rates are highest among veterans, older white individuals, and younger American Indian and Alaska Native people. What is especially devastating is how this has affected our children. Firearm violence has become the #1 cause of death among children and adolescents, more than car accidents or drug overdoses. I've sat with parents who've lost a child to firearm violence. I've listened to their stories and felt their pain as they describe the holes in their hearts. As a father, I know a parent's worst nightmare is to lose a child, to feel like you can't protect your child from harm. Beyond these precious lives that are lost to firearm violence, there are wider ripples of harm to those who are injured, who witness the incidents, who live in urban and rural communities where such violence takes place, and who constantly read and hear about firearm violence in the news. The collective trauma and fear that Americans are experiencing is contributing to the mental health challenges that we are facing today. Nearly 6 in 10 US adults say they worry about a loved one being a victim of firearm violence. Our children should not have to live in fear that they are going to get shot if they go to school. None of us should have to worry that going to the mall or a concert or a house of worship means putting our lives at risk, or that we'll get a call that a loved one in a moment of crisis has taken their own life with a firearm. All of us, regardless of our background or beliefs, want to live in a world that is safe for us and our children. The Surgeon General's advisory lays out the approach we can take to address firearm violence as the public health crisis that it is. This includes implementing community violence prevention programs and firearm risk reduction strategies, improving access to mental health care for those exposed to or at risk for firearm violence, and expanding research funding to inform and evaluate our prevention strategies. Firearm violence is a public health crisis. Our failure to address it is a moral crisis. To protect the health and well-being of Americans, especially our children, we must now act with the clarity, courage, and urgency that this moment demands.
I'm trying to short.
Well, the video was very informative and very relevant. And with that, I'll introduce our next speaker, Dr. Archie Bleyer.
You've done your job.
Perfect. Are you coming up?
Yeah, I'm going to stand up here. Okay, thank you, Anne, for this. Oh, wow. Plus, okay, I'm sorry I don't have my white coat, but then Dr. Murthy didn't have a white coat on either. Oh, I'm sorry. Okay. What I'd like to do, and I guess I can do this with advancing this. Yeah, oops. Advance.
Here.
This one? Yeah. I found a little go forward button. Go forward. We got to leave today by going forward. Okay, I want to take his and our Surgeon General's advisory report and apply it to Texas. And I have 5 minutes to do it, but then I got another chance later to fix it too. All right. 4 weeks ago yesterday, a month ago yesterday, on the first day of school at Rice University, Andrea Rodriguez, at the age of 21, first day of school here in your state, our state, died as a result of her 23-year-old boyfriend, take away the friend part of that, who murdered her in the dorm room at Rice and then suicided, murder-suicide, which is increasing on a daily basis in our country. But what about Texas? Well, you've seen that in the United States, the number one cause of death between the ages of 1 and 19 is bullets. What about Texas? Looking at that age range from 0 to 19, including infants, it's the number one cause of death in Texas. But, whereas it went up on the left about a doubling, in Texas it's almost tripled, 2.5 to 3 times greater over that same interval from 2012 to 2020. So Texas has done worse than nationally. If we again look at the same age group, under 20-year-olds, 0 to 19 years of age, in 2022, and I want to emphasize 2022 is the last year of non-provisional final CDC, Centers for Disease Control and Prevention results that are available. Anything from 2022 is provisional and uncertain as such. So if we go back to 2022, a couple years ago, and you look at the number of firearm deaths, which ranged from less than 3 per state, that very light color, to the darker red of 543 in the state under age 20. Texas was the 543. 12% of all deaths in the United States from firearm before the age of 20 occurred here, within the borders of this in your state. And it represents 9% of the country, so right away you know you're disproportionately killing more young people, including infants, children, adolescents, teenagers, and young adults. Go back a century to the data from 2011 to 2014, according to the CDC. Each of the states were ranked in one of those quintiles in the bottom in terms of the number of firearm deaths per year over those years, those 4 years. And you can see on the lightest color, almost hardly visible, on the left, the lowest death rate, and the darkest blue is the worst. Back then, Texas was one of the lightest colors. Bravo. But in 8 years, it moved into the middle quintile. Just 8 years. A gruesome statistic. And it was the only one of 2 states that did something like that. The other one being Maryland. No other state besides Texas and Maryland had had worsening to the degree that you are seeing on the screen now. And you, most of you, live here. Here's something that I had to put together just from my own unbelievable stats. Okay, starting with 2000 on the furthest left, and then every 3 years, the rate up until 2022, again, the last year that we can have reliable, dependable, non-provisional data. The percents are the percentage of all deaths in the United States that occurred in Texas as a result of firearms. So back then, it was 9%, 9%, 9%, which was because there's 9% of the country living in Texas. You represent 9% of the total population. But look what happened after 2010. Went all the way up to 13%. That trend is ominous. As of 2022, 1 in every 7 persons before the age of 20 died of a bullet in Texas. 1 in every 7 right here within the borders. And it was 1 in every 12 back then, just a decade ago. Now here's a wider age range. It goes from birth on the left to age 40 on the right. And the red line, well, I'll give you each one of them. Let's start on the furthest right. That's the cancer deaths. Again, up to the age of 40, green line. Number of deaths. Then comes the heart disease, next worst, followed by COVID back then, not now, but back then, although we're still having challenges. Then in the purple, drug accidental poisonings, overdoses, fentanyl, opioids, other drugs. There's the motor vehicle accidents in blue. And right there, all the way up to age 30, the number 1 cause of death, as of the last available, dependable data, bullets. Nationally, it was up to the age of 19. In Texas, it's up to the age of 29. And if you look at the red highlighting of the gun deaths, firearm deaths, bullet deaths, it is one of the, if not the number one or 2 cause of death up to the age of 40. So in applying the Surgeon General's report to Texas, Vivek Murthy, Dr. Murthy, and his team at the Department of Public Health Service can do more for the United States right here in Texas than they can in any other state. You have the opportunity of helping the entire country. So I want to ask a question before giving up my 5 minutes. What should we focus on? So I'm going to ask you to raise a hand of your choice over 3 age groups, up to the age of 29, so less than 30, 30 to 60, meaning middle age adults, and then 60 or older, including 87 and 81-year-olds.
Yay!
Yay, you got that. Thank you, Ann. Honorable Ann. So I want to ask you first this, how many would prefer to focus, if we had to, on the youngest? Children? Okay, next question. What about this age group in the middle? Thank you. There's got to be yes and yes, all right. And then, of course, my age group, and so, hey, come on. Yeah, okay. Yeah, it turns out, at least for our age group, suicide by firearm is becoming another crisis at our age. Okay, last, and this is also to show you how vast and impressive the Murthy Surgeon General, U.S. Surgeon General report is. Here are a set of his recommendations. Today, I want you and me to focus on 4 of them. There are, 8, 9, 10 of them on there. And I'm going to ask you to vote on these. Require safe, secure firearm storage, including child access prevention laws. In other words, states that prevent the possibility or the probability of a young person dying because of access to a firearm, usually in a home setting. The second one will be to decide on banning assault weapons and the ammunition too. There's an amazing story about that at the pre-luncheon session. And to hold from being owned by civilians in the United States. Third is to treat firearms like consumer products and hold the gun liable industry liable, like we do for everything else except firearms. And then finally, I'll add it later, the issue of mental health, blaming the problem on our mental health in this country. Okay, so let's go back to the first one. There's something not quite working here. I guess I'll do it this way. Okay, How many would prefer number 1, the safe storage secure? Okay, I'm going to put a hand up for that too. Okay, if you had to choose, what about banning assault weapons? That's controversial. Okay, I'm impressed. The last time I did one of these with y'all, I was told it's not feasible. Don't waste your time. Okay, we'll come back to that this later because you put your hands up. And then, as we heard from Honorable Ann Brown, yes, treat consumer products. Okay, so I got to do all 3 of those. There's one more, removing the mental health issue. We just published that 3 weeks ago, so I think some of you heard about it. Don't blame the mental health of the United States. It's the guns, like Gabby Gifford says, it's always the guns, but I like the fact there are a few hands up. Okay, we won't do that probably this afternoon. Okay, let's just get over this and go on with the final statement. His conclusions are that many experts and leaders work tirelessly every day, like you are doing, to prevent the trauma and suffering, illness, disease, mortality of weapons that shoot bullets. And there's a list there of you all, volunteer organizations, etc., medical, that are trying to solve the problem. But it'll take more than that. The entire country, everybody, all of us will have to help solve this problem. No matter what our stance is, which side of the aisle, where we have our office above us here or away from here. Everybody, that's his final line. So every single person in this room and everybody that you meet on a regular basis, including children. I've talked to 3- and 4-year-olds about this. We have a 17-year-old, a 19-year-old here. So that's the bottom line. If you notice some bullet holes in the upper corners there, I apologize, in case you thought there. But then we need that kind of focus too. So thank you again for your time. The solution is for the rest of the day. Thank you.